Hello everyone, my name is Shayla Kennel, and today I will be presenting my Media Clip final presentation. So my presentation is going to be about the disabilities that we require to do in Module 8. I'm going to go over each disability, kind of give you a definition of what each disability entails. I'm going to go over the characteristics of each disability, as well as strategies we can kind of integrate and include to help accommodate each student with these disabilities. Okay, so the first PowerPoint we're going to go to is specific learning disabilities. So when we talk about specific learning disabilities, it's a disability in where there's a discrepancy between a person's ability and academic achievement. Individual possesses average intelligence. So here I have included some pictures, kind of just giving you some examples so you could see for yourself as well. So some characteristics with individuals that possess specific learning disabilities would be reading. That would be the most common problem encountered by children identified as learning disabled. And then also some students you might find have ADHD. I actually have a friend that has ADHD. And then also some may have difficulty attending to tasks. That means they have trouble staying on topic. They just have trouble with dealing with tasks in general. Okay, so as I'm going through each slide, I won't go through everything just because of the time and there's so many slides, but I'll just kind of give you the basics. So ways you can integrate or include students that have specific learning disabilities. So you can capitalize on the student's strengths, use short sentences and simple vocabulary. You don't want to use too complex vocabulary to where they can't understand. You want to allow flexibility in the classroom procedures. You want to provide positive reinforcement of appropriate social skills at home and at school. So like I said, just bear with me. We won't go over everything because I do have a lot of slides. Our next disability is going to be speech and language impairments. So definition of speech and language impairment with individuals that have a speech and language impairment. So it's a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects an individual's education performance. So here I have a picture, and it just has everything around it that a speech and language impairment entails, and the difficulties an individual may have. Characteristics with speech and language impairments: you might misunderstand things, you're going to have difficulty with communicating certain words and phrases, inability to express ideas, improper use of words and their meanings, inability to follow directions, reduced vocabulary, inappropriate grammatical patterns. So those are the basic characteristics that students with speech and language impairments are going to have. So ways we can integrate students with speech and language impairments. So I won't go all over these, like I said, but you can use speech therapy. That is usually the main type of therapy that'll help with speech and language impairments. I actually have a nephew. He was 6 months behind in his speech and language, so he did have a speech and language impairment, and he had to go through speech therapy. Excuse me. He had to go through speech therapy for a little bit, and he's much better with his words. So you want to use simple, brief directions. You want to speak slowly and clearly. You don't want to over-exaggerate your speech. You want a very loudness to increased attention. You want to make instructional transitions clear. Things like that are good ways you can include students with speech and language impairments. And like I said, there's way more on here that you are more than welcome to read as I go through here. Emotional disturbance. So with emotional disturbance, that is a condition exhibiting one or more of the following characteristics over a long period of time and to marked degree that adversely affects a child's education performance. So A, inability to learn that cannot be explained by intellectual, sensory, or health factors. B, an inability to build or maintain satisfactory and personal relationships with peers and teachers. And then it goes all the way down to E. So some of the characteristics and behaviors seen in children who have emotional disturbance would be hyperactivity, aggression, withdrawal. You're not interacting with, you're not interacting socially with others, immaturity, and learning difficulties. So ways we can integrate or include students with emotional disturbance. We can support the student's inclusion. We can set clear behavioral rules and expectations for the entire class. Recognize students' accomplishments. This is going to help them, it'll help them a lot with their emotions. When you recognize their accomplishments, they feel good about themselves. They feel confident. You want to encourage organization and routine. With children and students that have disabilities, it is a little bit harder for them to have organization just because of, the disabilities that they do have. So you want to make sure you encourage that with emotional disturbance, with individuals with emotional disturbance. So intellectual disabilities. So this is also known as mental retardation. This term is not used as often anymore just because of how harsh it is starting to sound and the way people are using it today. So an intellectual disability, that's characterized by significant limitations in both intellectual functioning and in adaptive behavior, which covers many everyday social and practical skills. So some characteristics of an intellectual disability is you have trouble speaking, you have trouble understanding social rules, you're having trouble solving problems and are thinking logically. So you're having trouble solving math problems. I know I do at times. You're having trouble seeing the consequences of your actions. You're using logical to plan ideas and solve problems. Things like that. Those are some good characteristics of intellectual disabilities. So ways we can kind of integrate and include students with intellectual disabilities in the classroom. We can teach in small groups or one-on-one if possible. When you have a bigger class, it is a lot harder to, get that one-on-one time. But if you have a paraprofessional in the room or student aid, it would help a lot to try to do one-on-one with those specific students. You want to teach one step at a time, and you want to try to help support memorization and sequencing. Okay? Autism. I actually know a lot of my friends that have autism. So it is a developmental disability which significantly affects verbal and nonverbal communication as well as social interactions. So the characteristics of autism. So social communication impairments. All individuals with ASD exhibit social communication impairments. Some social difficulties include demonstrating appropriate play skills such as cooperative play with others. Some may appear uninterested in trying to play with their peers. Staying on topic, turn taking, asking or appropriate question during conversations. Okay. Taking their communication partner's perspective, checking for understanding. Things like that are some characteristics of autism. Okay. On the left here are some more characteristics I won't go over because I am, running out of time. And then here is another slide of more characteristics and another slide of characteristics here. I was trying to include as much pictures in my presentation just to kind of give you an idea of what each disability is like. So ways we can include it in a classroom. You want to keep your language simple and concrete. You want to teach specific social rules, skills such as turn taking and social distance. You want to give fewer choices. If you keep giving them more choices, they're going to get confused and a little frustrated. Okay, you want to avoid sarcasm and you want to avoid idioms, such as put your thinking caps on, zipper your lips. You want to refrain from using those phrases. All right, visual impairment and blindness. So visual impairment includes blindness. It means an impairment in vision that even correction adversely affects a child's education performance. The term includes both partial sight and blindness. So characteristics could be poor eye-hand coordination, poor academic performance. We have clumsiness if you're starting to fall and trip over everything, and behavior. Those are some characteristics of individuals with impairment or blindness. So ways we can integrate this in the classroom. So you can stay in a classroom, you can perform the teaching of Braille Usually they have teachers that already know how to do this if you don't know how to do this. So you can learn as much about the student's specific visual impairment. Okay, this would include how vision is affected, how does that affect the student's ability to move around the classroom, see the board, or read a textbook. It's very important that you learn as much as you can about that student's, visual impairment. That way you can better help them in the classroom. Hearing impairment and deafness. So hearing loss is the reduced ability to hear sound. Deafness is the complete inability to hear sound. So deafness and hearing loss have many causes and can occur at any time at any age. Symptoms could be mild, moderate, severe, or profound. So the characteristics of hearing impairment and blindness is hearing loss may impact a student's ability to produce sounds, hear and understand language, produce oral language, understand new concepts. So ways we can integrate this in the classroom. So we can use interpreters. You want to allow the interpreters time to make sure that they can sign as you talk. And then you want to see if you can possibly give them the lesson plan before class. Teacher aides, you can use note takers. All of those things are going to help us during the classroom with students with impairments or deafness. Multiple disabilities. So multiple disabilities here, they're defined as concomitant impairment, such as mental retardation, blindness, mental retardation, orthopedic impairment, the combination of which causes such severe educational problems as they cannot be accommodated in special education programs. So some characteristics, cerebral palsy and seizures, behavior disorders, muscular dystrophy, limited speech or communication. So ways we can integrate this in the classroom is we can clear the room of obstacles, use assistive technologies, provide a range of experiences. Traumatic brain injury. So this is caused by an external force that results in a disability or psychosocial impairment. Okay. Some characteristics are language memory, you have problem solving, judgment, abstract thinking, perceptual, motor skills. So for these that have TBIs for short, it's difficult for them to stay on task. Ways we can integrate this in a classroom. You want to give more time on tests, decrease the assignment load, and you want to have the student type instead of writing by hand. Okay. Physical disabilities and health impairments. So these right here are some of the characteristics of physical disabilities and health impairments. So you might feel fatigue, mobility issues, coordination difficulties, muscle weakness, and stamina. That's physical disabilities and other health impairments are kind of in the same category because physically you can feel fatigue, mobility issues, things like that. So ways to integrate this, we can be flexible with the student, use visuals, hands-on learning. A lot of students can learn hands-on. I'm good with hands-on. You can be flexible with the student, partner work, cooperative learning. All of those are good choices. So gifted and talented students. Now, this is where an individual possesses abilities and traits that can be demonstrated, okay? So some characteristics could be they're early readers, they're highly verbal, they're highly inquisitive, they're intellectually curious, they're highly motivated, and they always want to learn. So some strategies to include them is we can have differentiated instruction, which we talked about earlier. We can structure class months assignments so they require high levels of critical thinking but permit a range of responses. And that is the end of my PowerPoint. I really do hope you guys enjoyed, and I do apologize that I wasn't able to get to everything within the 15-minute time mark, but you are more than welcome to read over my presentation as I tried to include a little bit of everything, definitions, and I tried to be as detailed with the characteristics and everything as far as the disabilities go. Thank you guys. Y'all have a wonderful, wonderful rest of your semester.